So we are going to talk about something called neck-related arm pain. It sounds kind of funny, but your neck can actually cause quite a bit of discomfort in your arm if you know what to look for. I'm Dr. Sarah Sewell of Resilience RX, and tonight we are going to talk about neck-related arm pain. So all of your nerves, they start in your neck, right? And they come out and they innervate your entire body. Now, a lot of these nerves go down your arm. These are the nerves that are agitated or irritated when you have neck-related pain. Sometimes this pain starts up at your neck and it travels down your arm. Sometimes you feel it more here, kind of in the front of the shoulder. Sometimes you feel it here, the side of your neck. Sometimes you feel it in here. Sometimes you feel it back here. Sometimes you feel it here. If you get the point, you can feel it in a lot of different places. Sometimes you feel it in all of those places. It 100% depends on which nerve is involved and to what extent that nerve is involved. So there's three main nerves that run through your arm that can be affected by stuff going on at the neck. The first one and the most common one is the median nerve. If you're curious whether or not your median nerve is a little irritated, sensitive, or you're having some arm pain, you think it might be coming from your neck, the best way to check is going like this. So you're going to straighten your arm fully. Your hand is going to go flat. I'm not going to stay in that position very long because I actually get tingles and numbness in my first three fingers with that. That is not uncommon. It's not ideal, but it's not uncommon. The issue is with this is, does it reproduce your symptoms or is there a side-to-side difference? So if I'm here and I get symptoms on this arm, but I can go all the way here and then I get symptoms on this arm, then that's a difference. That's significant. If at end range on both sides, you're like, my fingers are a little tingly or I feel a stretch, that's normal. There is going to be some restriction. So for that median nerve, this one's the one that's most commonly restricted, so it's the one we're going to talk about the most. In order to help decrease the sensitivity of that nerve, we're going to do a nerve floss. So it's a lot like flossing your teeth. You take something, you move it back and forth to increase blood flow. So this is lengthening the nerve, going like this, as is moving your head away. So you're going to shorten the nerve on one end while you lengthen it on the other end. So I'm lengthening and shortening. So you move back and forth together. It looks kind of funky. It looks like a bad dance move, but this is essentially what you're going to do. If that motion there is giving you some more symptoms than we would like, which is really anything more than mild. So if it's making things worse, that's too strenuous on that nerve. It's a little bit too much on stretch. Nerves are not necessarily like muscles. They're very ornery 2-year-olds. They throw temper tantrums when they're stretched. They don't like stretch at all. And with a nerve, sometimes with muscles, you work into discomfort. With nerves, it's highly advised against that because you flare them up and they're like, wee, we're off for a ride. They're hard to calm down. Because of that, what you can do is you can put a little bit of a bend in your elbow and do the same thing. This is a much less strenuous on the nerve, so it puts less stress on it. If the head motion is bothering you, you can do a ballerina to a waiter. This is moving that nerve back and forth, but it's not moving your head. So sometimes when people's neck is causing them arm pain, moving the head flares stuff up. So that's a way to move that nerve back and forth and not agitate the neck. So that is how to know if your median nerve is causing some pain in your arm. Starts in your neck, goes down your arm, how to test for it, and then what you can do about it to help calm it down. Essentially move it back and forth, give it a good floss your teeth when you're done, and have a wonderful day.